Well, first off, before we get into anything else, what does economics mean? Economics is the definition of economics is the allocation of scarce resources. Allocation means spreading around. And what do we mean by scarce resources? Money. Economics is the how money is spread around. So the healthcare or economics of healthcare is how do we spread money in terms of patient care fairly and evenly. So what affects the rising costs of healthcare? There are two main factors, intrinsic and extrinsic factors. Intrinsic and extrinsic factors. Take notes. Intrinsic factors are factors that are within a population. So the population characteristics, the age, the race, where they live, the demand of healthcare, if there's insurance available. Those are intrinsic factors, things that are within the people, the population. Extrinsic things are on the outside. So the availability of technology. Specific example, when I was at Aurora, they had an MRI machine 3 days a week, Monday, Wednesday, Friday. If you came in on a Saturday and needed an MRI, we couldn't do it because it was only available 3 days a week. So the availability of technology was a factor on the healthcare cost, because if you needed an MRI, needed it, we had to send you somewhere else at our cost. Prescription drug costs is an extrinsic factor, and prescription drug costs are huge and only going up. The cost of workforce. Our pay is an extrinsic factor. The workforce of anybody associated with healthcare is an extrinsic and external factor driving up the costs. Intrinsic, things within inside. So population demographics, the availability of healthcare, the demand for healthcare. When you see the commercials for Humira to treat rheumatoid arthritis, that is driving the demand for healthcare up. It also has that same demand, though. The cost of Humira is an extrinsic factor. So there are many ways of helping to control this. As nurses, we need to have good clinical skills and business skills to be full participants. We need to be smart providing care. Again, bringing in the right amount of dressing equipment so we provide smooth, efficient care without running for more pieces that we forgot, but without bringing too much in that gets wasted. So that's good nursing skills, but we also have to be smart in providing business skills. So we will teach our patients how to stay healthy. We'll teach our patients about using generic medications. We will encourage our doctors to write prescriptions from Walmart that are on the $4 list so our patients can afford the medications. That's business skills. Clinical skills and business skills have to go together. The United States spends 16% of every dollar on healthcare. 16% of every dollar goes to healthcare. There's only one thing we spend more on, and that's energy. And to be honest, we don't have the best healthcare system in the world. We don't have the best longevity. We don't have the best neonatal lowest death rate there. We provide good care. We provide expensive care, but not the best care. So that's something that always needs to be worked on. Now there are choices in healthcare. And sometimes rationing comes into play, and typically Americans hate rationing. What is rationing? Rationing is when you have a set amount of whatever, and people can only have a little bit. Give you a specific example that affected my family. About 7-8 years ago, my son became sick. I suspected flu. He had every symptom of the flu. I mean, his hair hurt. He had high fevers, shaking chills, nausea. His joints hurt. His legs hurt. Like I said, his hair hurt. No nausea and vomiting because that's not flu. But everything else. I called his doctor. He has asthma. So I called his asthma specialist. I said, should I bring him in and get tested? I described the symptoms. He goes, I don't need to test him. I trust your judgment. I trust you know what flu looks like. You've described flu perfectly to a T. So I'd like to get him tested for the, what kind of flu he has. And because if he has flu, I'd like to get him on some Tamiflu. The doctor, I'm talking to the doctor at this point, and he paused. He goes, Trevor, I'd love to test you, but it doesn't matter. I only have enough Tamiflu for 20 people. And I'm responsible not only for my clinic in Green Bay, but for all the clinics on the Oneida Nation nearby. I have 20,000 people at risk, and I have 20 doses. I can't justify giving it to your son because you're a nurse and you can provide the care he needs. Man, that didn't make me happy. There was nothing I could do about it. My son recovered fine. He was sick for about 10 days. What are you going to do? It's life. So we have to look at all sorts of things. We want to make sure that people are getting the right care, the right amount of care. Not too much, not too little. Too much, going to the doctor for every cough that you have. And in the ER, we see that. We see people going to the ER for trivial nothings. So they're going too often. They're not going to the right provider or the right setting. An ER is not a primary care physician, although people with no insurance use it as a primary care physician. They have no other way of getting medical care. So we need to find the best method of care. I talk about people wanting Humira for rheumatoid arthritis. Well, have they tried methotrexate yet? If they haven't tried methotrexate, try that first. It'll probably work for a lot less money. But people want the newest and best. But that's not necessarily the right method. So all those things, people going to the wrong provider, wrong setting, wrong medication, going too often, and going to specialists when they can go to primary care, those make healthcare costs shoot up. And we all end up paying for it. Our insurance rates go up to cover that. The cost of medicine goes up to cover that. The cost of doctor's visits go up because people are misusing the system because probably they don't know better. Come back to the next section. We're going to talk about how healthcare is allocated throughout the system.